Friends, myself Dr. Shishir Patel. I am practicing physician, diabetologist, cardiologist since last 4 years at Patel Hospital, Gotri, Vadodara. I will be talking on very important topic of hypoglycemia, which is very important for diabetic patients. The first thing, what is definition of hypoglycemia? The first thing is clinically important hypoglycemia means if blood sugar is less than 3 millimole per liter or less than 54 milligram per liter, that means it is a clinically important hypoglycemia. And second thing is relative hypoglycemia, that means if your sugar is less than 70 mg per dl, that is relative hypoglycemia. In clinically important hypoglycemia, you have to take treatment immediately. In relative hypoglycemia, you may have time, you have to rush to your doctor, and you may consult your doctor within a day or two. The second thing, what are the causes of hypoglycemia? Many patient comes to us, sir, we get repeated hypoglycemia, we have to take sugars regularly, but they don't consult to doctor. But my request to all of you, please consult your doctor even with a single episode of hypoglycemia, because single episode of hypoglycemia may cause cardiac arrest or sometimes may lead to permanent brain damage. So it is very important to know the cause of hypoglycemia, so that if you improve your cause, you may not get the second episode of hypoglycemia. What are the causes of hypoglycemia? First important cause is excessive dose of insulin, may be taken by a patient or may be given by a doctor. Second is diabetic medicines. Many diabetic medicines patient may forget instead of taking one tablet, he may take 2 tablets, or sometimes doctor may have prescribed higher doses, that also lead to hypoglycemia. Second is excessive consumption of alcohol causes hypoglycemia. Prolonged fasting, especially we Indians do prolonged fasting without any food, and if we take medicines during that period, especially long acting diabetic drugs, may cause hypoglycemia. Then late meals, many times we take breakfast in the morning, we may not get a time to take lunch, and we wait till evening for a dinner. In such cases, late meals, hypoglycemia may occur. The next is no snacks between meals. In a long period of time, if we take breakfast in the morning and we wait for a 3 or 4 o'clock for a lunch, and if we don't take any snacks in between, hypoglycemia may occur. So if we don't take any snacks, also is a common cause for hypoglycemia. Then less meal than routine, whatever we are taking routine diet, if we take less than that, also can cause hypoglycemia. Then some medicines, like especially painkillers, which also causes hypoglycemia. Some hormonal disorders and some liver diseases and kidney diseases, especially liver failure, kidney failure, which are also common with the diabetic patients, also is a very common cause for hypoglycemia. And any illness, any fever, any loose motion, any vomiting also can lead to hypoglycemia. Then what are the types of hypoglycemia? First one is a symptomatic and second is asymptomatic. In symptomatic hypoglycemia, patient gets some symptoms, some warning signs before he is getting critically low sugar, and in asymptomatic, patient becomes directly unconscious without getting any warning sign. First and foremost, in symptomatic hypoglycemia, if sugar is mild to moderately low, in such case patient will get shakings of hand, tremors, tremblingness, excessive perspiration, sweating, or excessive fast heartbeats or impaired vision. Then anxiousness, very anxious nature, dizziness, giddiness, hunger, weakness, generalized weakness, fatigability, severe headache and irritability. These are the all symptoms of mild to moderate hypoglycemia. If the same patient gets critically low sugar, if in that case, if we don't take anything by mouth and he gets critically low sugar, he may become drowsy, unconscious, or he may get seizure, transient paralysis, or totally irrelevant behavior. These are the symptoms of severe hypoglycemia. In severe hypoglycemia, please remember always, rush immediately to the hospital, because in such cases sometimes cardiac arrest or permanent brain damage can happen. And if such patients are conscious, only then give something orally, or if he is unconscious, don't give anything by orally, because in unconscious patient, if you give something, he may aspirate and he may die because of that aspiration. And the second patient, asymptomatic hypoglycemia. Such symptoms are common with long-standing diabetic or the patients of diabetes who have autonomic dysfunction. In that patients, only I will give some precautions. Please don't drive, please don't dive, please don't swim, please don't go to the risky places such as heighted places, hill stations. or don't work with any electronic machine. While doing that work, if you may get been damaged because of unconsciousness, please avoid such situations, because you have a problem of asymptomatic hypoglycemia, because you don't get any warning sign before getting unconscious. So please avoid such scenarios if you have the symptoms of if you have asymptomatic hypoglycemia. And in that case, most of the doctors keep sugar towards higher side. So if you get any episode of asymptomatic hypoglycemia, please rush to the doctor, tell him that such thing has happened, and modify your dosages. Because with modification of doses, if you keep your sugar slightly towards higher side, you may not get such asymptomatic hypoglycemia. Then many patients come to us and tell, okay, sir, I get daily fatigability, excessive hungerness, sometimes giddiness, sometimes dizziness or blurring of vision. These are the symptoms which are common with hyperglycemia and hypoglycemia. So please remember always, these are the symptoms common with hyper and hypoglycemia. Don't consume sugar only with symptom. Please check your sugar before any symptoms you get. If your sugar is below 70 or 58, then only you eat sugar. And even in that case also, even with a single episode, please consult to your doctor. Please modify your regimen. Please know the cause of your hypoglycemia. Please rectify that, so that you don't get repeated hypoglycemia. You don't have to take sugars regularly, because even I have already told, even a single episode of hypoglycemia can cause permanent brain damage or cardiac arrest. So with only symptoms, don't judge that your sugar is low and don't eat sugar. Please check your sugar before eating anything. Now if your sugar is less than 58, you have checked your sugar is less than 58, and now what to take. If you are conscious at 58 sugar or less than 58 sugar, only then consume 15 grams of glucose, which is present in half glass of fruit juice, 3 to 4 hard candies, 3 glucose biscuits, hypotab, 3 TSF table sugar, or 2 TSF of honey. Anything out of these 6 or 7 things, you may consume any one thing, and after 15 minutes of that, check your sugar again. Please don't give anything if patient is unconscious and his sugar is low. In that case, you have to rush to hospital and you have to take IV glucose, not oral glucose. And then after checking 15 minutes, if your sugar is more than 100, don't repeat anything out of that. And second thing, if your sugar is less than 100 and after taking 15 grams of glucose, your sugar is again 100 after 15 minutes, then again you have to repeat 15 grams of glucose. That 6 or 7 things you have to repeat again, and again you have to check your sugar after 15 minutes. In the both case, first case was sugar was less than 58, you have taken 15 grams of glucose. After 15 minutes you have checked your sugar, that was more than 100. And in second case, your sugar was less than 58, you have taken 15 grams of glucose. After 15 minutes your sugar was less than 100, you have again repeated 15 grams of glucose. In both cases you have to consult your doctor immediately on the same day, so that you have to modify the regimen, or you have to know the cause of your hypoglycemia, so that it may not recur again. And in my lecture, you must have heard many times that less than 58 sugar, less than 100 sugar, or less than 70 sugar. That means the glucometer is very important while managing your sugar. So please keep glucometer with you. And at the end, if you like my video, please don't forget to subscribe my channel. My channel's name is Dr. Shishir Patel Health Secret. I regularly make videos on many topics of medical things. And if you don't want to forget the notifications, please don't forget to click on bell icon. And Jai Hind, Jai Bharat.